Thank you, Mr Deputy Speaker. I rise to wholeheartedly support the Healthcare Governance Amendment Bill 2018 and believe it is vital in order to make any inroads into the mess that is our health system that has been left to us from the previous government. I just want to remind those opposite of the current state of health within this state, because it sounded as though when the Shadow Minister was talking that he'd completely and entirely forgot about the current situation. The people in the state are shocked, disillusioned and angry at the continuing reports of failings in our system, particularly in a $2.3 billion new hospital that has ambulances ramping outside of it for lack of beds. An electronic patient record system that is hindering instead of helping health professionals, inedible food for patients, of inappropriate and insufficient facilities to properly and timely treat mental health patients, of a design so precarious that archived patient records can't be shifted in where they can be accessed by clinicians because the building has been deemed to not to be able to handle the weight. And have you ever heard of such a thing, Mr Deputy Speaker? And stressed staff dealing daily with over-capacity emergency areas, where expensive renovations have had to be carried out to fix ill-conceived design flaws, chemotherapy treatment mistakes and waiting lists hitting record lengths last year, years in some instances. And only last week, the calls to place patients across the road in motel rooms to free up beds. Management and service delivery must improve for patient safety and also for staff, health and morale. Unbelievable that we, South Australia, spent $2.3 billion, and one could mount a strong argument that we are in a worse position now than we were before. Not many bodies could manage that, Mr Deputy Speaker. It is a fairly impressive feat to spend that much money and make the situation worse. Indeed, the South Australian Labor Party might be one of the few that can manage such a feat. And we are in this position for a few reasons. One being that the advice of people in the know, the advice of clinicians who work at the coalface, the nursing staff, the specialists, the very people who see firsthand the issues, service gaps and impacts on patients and their care, were not heard either through willful ignorance or a complete failure to engage them. The advice of medical professionals were not sufficiently valued. Improvements to policy and governance must be led by doctors and medical leaders. And it isn't just the new RAH, that is just one hospital in the state. There are needs in every hospital and health service across metropolitan and rural South Australia. And as important as this legislation will prove to the city, it will be equally important in the country, where so often in the past smaller regional health services have been treated as secondary tier concern. For country health services, this Healthcare Governance Amendment Bill is going to prove vital, because when a system is in as deep as it is, with so many issues facing it, there's surely no such thing as having too many heads working on a solution. This Healthcare Governance Amendment Bill backs the message from this government on this side that decentralisation is needed. The emphasis must be placed on local input in decision-making. Local clinicians and communities who work inside our regional hospitals and health systems deserve to have a strong say in the future direction of the state's health system, and this bill ensures local boards will be accountable for the delivery of health services within their area of responsibility, including appointing and managing chief executives, controlling budgets and actively engaging with their communities and frontline professionals. Our doctors, nurses and allied health staff work under great pressure, and this bill will mean that they won't have more pressure imposed by a remote head office out of touch with local needs and challenges specific to regional areas. This bill establishes governing boards for 3 metropolitan health networks and 6 regional health networks and legislates new governance and accountability frameworks, including boards having the power to appoint a CEO and manage their own budgets. It has been well documented in the past 10 years Labor doubled SA Health's head office staff. It grew 4 times faster than our nursing workforce, and still excessive bureaucracy resulted in budget blowouts and poor project management. Putting real responsibility and accountability back onto these boards at the local level will provide strengthened oversight and improve patient safety. Health professionals and people at the coalface will be listened to, will be heard when urgent high-risk repairs and maintenance are needed. Being a member of the Wallaroo Health Service Planning Steering Group, I am well aware of the value of local knowledge, which is proving pivotal to responsible future planning for Wallaroo Hospital, viewed as a major facility within the electorate of Narungga. This legislation will ensure that all money raised in local communities is spent in local communities, that local bequests and private donations go to where they have been pledged, and in doing so restore faith and connection between communities and governance. This bill will see resources go where the need is greatest and not wasted. Health is too large and complex for it to be operated efficiently under a centralised system, and under the previous government, that is increasingly what we got. The former government, in their eternal wisdom when it came to health, abolished local health boards with the introduction of the Healthcare Act in 2008, which left health, worth $6 billion annually, with almost 39,000 employees and 77 hospitals and health services under centralised control. It went about as well as anyone could have predicted it would. The city-centric approach does not serve rural areas well. Healthcare varies widely across the state, and decisions are best made by those close to the area which the decision is concerning, by people who know what the local community expects, and especially importantly, with input from local health professionals. These people have been frozen out of the decision-making process since Labor removed the local health boards, and as a direct result, the maintenance and capital backlog in neglected country hospitals is reported to be in the order of $150 million. This bill will safeguard against more rural hospitals losing services and being downgraded. Yorktown Hospital surgical services were quietly downgraded in February last year. The hospital lost its general surgery, gynaecology and urology services, and I say quietly because the local Health Advisory Council were told not to talk publicly about the imminent loss of services prior to the announcement. And let me say, that included explicitly being advised from above to not let the local member, Stephen Griffiths, at the time, know of the plans. Incredible, that sort of thing that those opposite tried to impose on the people of regional South Australia and hoped they wouldn't notice. In absolute frustration over the last 10 years, communities have become increasingly despondent about having no voice. It is believed local communities lost decision-making authority over the 42 country hospitals across SA when the previous government removed their management boards. In their stead, HACs were designed to be the local voice for the minister, but they have been described as toothless tigers without directives on how to act, without clear lines of communication, and with no say on how funds they raise are allocated. Locals wanting to donate to their hospital have not been sure of where their money would go. In the media late last year, Dr Max van Dissel of the Kapunda Health Advisory Council lamented that 2 applications were made to use its fundraising to purchase a steriliser and an operating microscope, and that the local clinicians deemed essential, but both were knocked back by the minister. Another doctor from the Newry Upta Medical Centre, Dr Michael Hoopman, in November last year despaired publicly of the many battles faced by local doctors, which he listed as including outdated facilities, the winding down of services such as obstetrics, pardon me, made myself, and the local support of patients who are experiencing mental illness. He said he's been the Barossa for 25 years and that numbers at the hospital had halved. At a public meeting in Cornwall in March 2017, local doctor Tony Lyon Lloyd addressed the packed town hall describing the loss of the lifeblood of many small townships, the local hospital. Diminished by stealth, threatening the economic viability of rural doctors and, by extension, service delivery to patients. Of note were the supporting medical professionals who travelled from all over the state that night to attend, including from Mount Gambier, Robe, Kimber, the Barossa, Burra, Cleve, Port Broughton, Butte, Maitland, Kadina, and local mayors and members of the Rural Doctors Association and the Nurses Midwifery Association. This bill will ensure all money raised in local communities is spent in local communities. This was part of the 49 recommendations in the final report tabled from the Social Development Committee's Regional Health Services Inquiry in September 2017. It recognised that country people were crying out for community-raised money to go towards resourcing buildings, equipment and research in regional areas. It was recognised that country people who have been so committed and involved in the building, development and provision of country health services in their townships feel the government had abandoned them. This bill reconnects those local and knowledgeable people who are valuable state assets. This government has also pledged to invest $20 million to assist country communities to fill skill gaps, attract specialists and double the number of medical interns in regional SA. We are committed to fixing a broken health system. Patients in the Narungga electorate are often disadvantaged by distance and challenges in accessing doctor and specialist attraction and retention. But just like their city cousins, they are entitled to a fair access to health services. Regional areas cannot afford to lose any more services. Retaining health services is top of the list of concerns for locals and is what I hear most about. Our increasing and ageing population creates the need for state government investment to be made. At a health forum I ran in Wallaroo last October, then Shadow Minister and now Minister for Health and Wellbeing, Stephen Wade, MLC from the other place, heard firsthand the local issues. The Wallaroo Hospital needing expansion to cope with demand, increased out-of-hours X-ray services, ramped up chemotherapy services, help for stretched accident, emergency and ambulance services, and there is much more to be done. I urge those opposite to get on board, support this legislation and help fix your mess. Although it is not the Labor way to fix up after them, to clean up after themselves. Just as the federal member for Lindsay, Emma Hussar, makes someone else clean up after a dog's mess, we have been left with a huge, steaming pile of a health system to clean up, and we'll get stuck into doing just that. This bill today is the start of many actions planned by this new government to improve our health system for all South Australians, wherever they live. And I'm honoured to commend it to the House.
Member for Newland.
Thank you very much, Mr Deputy Speaker. Mr Deputy Speaker, I'm delighted to have the opportunity to speak in support of this bill, which is yet another example of where the Marshall Liberal government is delivering on a commitment that we took to the last election. I must say, though, that being lectured by those from the other side on health, given their track record, is really quite incredible.